Okay, quick note before we begin, I promise I'll be fast. This video was recorded ages ago, so I don't have these kittens anymore, and I might say some outdated stuff. But I do think the information is still relevant, so I just wanted to pop on here and say that this video is getting uploaded way too late. But enjoy!
You want to be in this video too? It's me. You want to be in the video too? Hi, buddy. Hi.
And welcome back to my channel. My name is Corin, also known as the Kitten Choreographer. My pronouns are he, they, and I am a teen with a passion for animal rescue and, in particular, kitten rescue. I have lots of kittens with me here today, as always, and in today's video I'm going to be talking about what vet care new kittens need. In this video, I'm going to be sharing all of the vet care that you should get for your new kittens to ensure that they are healthy. This is also the main vet care that all of my kittens get before they are adopted out. I am going to give a quick disclaimer before we get into this video, and that is that this video should not be used in place of going to a vet, and you should not take this as medical advice for your kittens. This is just to give a general idea of what your vet might recommend so that you're a little bit more prepared as you go into the appointment. And if your vet recommends something different than what I mentioned in this video, listen to them because they are the expert in this situation and there are different care plans for kittens and they're all good. Every vet is a little different, so it's okay if they do recommend something different. And this is just what my rescue and the vets I work with suggest. Also, sorry for the bad lighting, I don't know where my lights are. And I moved forever ago, but I don't know where they are, so I should probably find those. See? He's licking me right now. Very sweet, buddy, but I'm filming. And also, I know I said I would make this video like forever ago and then I didn't. It's just because that's the way things worked out. I'm making it now, and hopefully that's good enough. But let's go ahead and get into the vet care. So there's not any standard medications that you should give to your kittens under 2 weeks of age. I would of course take your kittens to the vet and get medications if they're sick, but if they seem healthy, there's not very much your vet can do until they're 2 weeks of age. But if you have kittens under 2 weeks of age and you're not a kitten rescuer, it's a good idea to take them into the vet just to, make sure they developed properly and all that if you don't know a lot about kitten rescue. But let's fast forward to 2 weeks of age, where they are old enough to get their first dewormer. At the rescue I work with, we use Pyrantel for the first dewormer. And then, as long as your kittens are healthy, there's nothing that we do for the next 2 weeks. But 2 weeks after the first dose of Pyrantel, at around 4 weeks, we give another dose of Pyrantel. Pyrantel is just a good dewormer that covers several different types of worms, but it does not cover all types of worms, which is why you will hear me talk soon about more dewormers that we give. At 5 weeks of age, we give a round of Albon, and this is like a 7-day treatment that we use to treat coccidia. Even if our kittens do not show symptoms of coccidia, we give this treatment because it's very common for kittens to develop coccidia around when they're weaning because their immune systems are lower, so the coccidia is able to attack then. Coccidia is extremely common in my area, so we just want to prevent coccidia from getting really strong and potentially hurting the kittens a lot, so we just go ahead and give the Albon. And then at 6 weeks of age, which is 2 weeks after the second dose of Pyrantel, we give a round of Panicure. This is another dewormer that treats some more worms that Pyrantel does not cover. And then at 6 weeks of age and at least 24 ounces in size, we give the first FVRCP vaccine. The FVRCP vaccine is a standard vaccine that all kittens should get. It covers a bunch of different illnesses that are common in kittens, including panleukopenia, which is deadly a lot of the time. So it's a very important vaccine for kittens to get. It's given in 3 different rounds, and the first round can be given at 6 weeks. And then at the same time as my kittens are getting vaccines, as long as they've been healthy up until this point, we give 2 more things. We give Revolution, which is a flea treatment, and this is even if kittens don't show symptoms of fleas because we want them to be protected from fleas in case they are exposed to any. We also give Cestex, which is yet another type of dewormer at 6 weeks, and this is going to cover all of the bases so that we know these kittens have no worms or any other parasites. And then 3 weeks after the first FVRCP vaccine, so around 9 weeks usually, or yes, at 9 weeks, they are given their second dose of the FVRCP vaccine. And this usually lines up with the same time as their spay or neuter. Kittens can be fixed at 8 weeks and 2 pounds, and they absolutely should be fixed, even if it is a little bit later than that. The earliest kittens can be fixed is at 8 weeks old and 2 pounds. Because most of my kittens are bottle babies, they run smaller some of the time, so they usually don't end up getting fixed until 9 or 10 weeks. And that's because they aren't always 2 pounds right at 8 weeks. And it's also hard to get appointments, so sometimes the appointments are just a little bit later than right when they hit 2 pounds. And just wanted to note here that you absolutely should be fixing your kittens. There's such a big issue with overpopulation that it's like non-negotiable in my mind that you should be getting the spay or neuter for your kittens. It's a very minor surgery if you're worried about that, and they recover so quickly, and it's just prevents so much pain and suffering for cats. They also continue to get revolution every month for as long as they're in the program. And you should be keeping your kittens up to date on a flea treatment. You can talk to your vet about whether you want to do an every month or every 3-month treatment. But your vet can prescribe the best one for you. And then kittens should get a 3rd round of the FVRCP vaccine at 12 weeks old. I usually don't have my kittens anymore at 12 weeks because they're adopted out pretty much right after their spay or neuter, but the rescue I work with does cover the 3rd round of the FVRCP vaccine if they want to bring their kittens back to get that. And sorry if you hear my dog, she wants outside, but she can't go outside right now because we have people in the backyard, so she will just have to wait a little bit. And then another important thing is a microchip. All of my kittens get microchipped while they're at the vet, and a microchip is not technically a necessary thing, but I find it to be very, very helpful in getting your kittens back if they were ever to get outside, so I definitely recommend a microchip. So my kittens are just microchipped at their spay and neuter, and then we give their microchip information to their adopters so they can register under their name. And then the last vaccine that is standard for cats to get is the rabies vaccine, but that vaccine can't be administered until they're 12 to 16 weeks old. Every vet kind of chooses when they want to administer that vaccine, so it's different for every vet. I definitely recommend getting this for your kitten, but the rescue I work with doesn't provide this because the kittens are too young to get it when we adopt them out. So that's like up to the adopter to get that vaccine for their kittens. And there are a couple other vaccines like an FVLV vaccine and a few others maybe that you might choose to get for your cat if your vet recommends it, but that's of course up to you and your vet to decide whether you think your cat needs that. So in short, once you've found a kitten, and maybe you found them outside, you want to make sure they are healthy. Once you've taken care of any obvious illness they might have, you're going to want to talk to your vet about some kind of dewormer, then you're going to want to keep them up to date on flea treatment, and that's good kind of for the rest of their life. And then you're going to want to get them up to date on vaccines. And that's even if they appear healthy, because that's just stuff you need to do. And they should also, of course, be fixed. And if your vet recommends that you wait until 12 weeks to fix them, that's okay, you can wait, but as long as they're fixed by 4 months of age, because that's when they can, start reproducing, and that's not what you want. And in closing, I just wanted to say again that this is just the protocol for the rescue I work with, and it may be different at your vet or with your rescue. And of course, you should always work with your vet to determine the best care plan for your kittens. But I hope this video was helpful, and best of luck with the kittens that you found or adopted. Thank you so much for watching. If you like this video, make sure to like it and subscribe for more kitten-related content. I upload on Sundays and on Wednesdays if I can, and if I can't, then I upload whenever I'm able to. Also, please make sure to leave any thoughts or questions that you have down in the comment section below. Thank you so much for watching again, and goodbye!